So if you're going to see your GP, it may be because you've got a specific symptom that you're concerned about, like passing blood in your urine or pain in your chest, or it may be because you're seeking advice as to how to maintain good health, particularly as you get perhaps into your 40s or 50s or 60s. One of the questions I think that's useful to ask doctors, if you're in that latter category where you don't actually have particular symptoms but you want to stay healthy, is what are the age-appropriate things I should be doing? What should be being checked for me on a regular basis to make sure that I maintain good health? Some patients will come into me and say, look, just test me for everything, and my response to them is we'd run out of blood, because obviously there are so many things that people can be tested for, and most of them they have not even the remotest possibility that they're ever going to get that condition. But we do know we have good data on the sorts of things that people may suffer from at different times of their life. And to go back to the car analogy, as the vehicle ages and becomes more mature, more things can go wrong, and when a patient comes to see me and they're 45, I can say to them, look, you're a 45-year-old man, these are the routine things that we should do in everybody of your age, and discuss them and see if they're acceptable to the patient. And then based on the history that you've told me, maybe your father had prostate cancer at a relatively young age, or your mother had bladder cancer, we're actually going to include these tests as well. And we're not just going to test you, we're actually going to examine you and see if there are any other things that are markers of abnormalities as well. I see many patients who come from overseas health systems because I work close to a university, and they're often the patients are quite surprised when they come in that I actually want to examine them, because in their countries of origin they just have a whole panel of tests done every year, and then the doctor looks at the tests and says, oh, you might have a problem with such and such. We know that a much more effective system associated with better outcomes is for the doctor to actually examine the patient, take the patient's history, apply that against a set of established principles, and then work out with the patient what are the appropriate tests to do. You live longer and you get better outcomes if you apply that system. So for patients coming to see their doctor, I think it's having an idea of asking about what's appropriate for your age, making sure that you tell them anything individual in your circumstances, your past history, your past illnesses, drugs that you may have taken or reacted to. And between you should then negotiate what's an appropriate way of maintaining and monitoring your health. Screening programs are often a hot topic in communities. If you've been diagnosed with any sort of significant condition with nasty potential implications for your health, it's very understandable that people say, well, could this have been picked up earlier? Could I have been screened for it? From a public health population level, we know that there are certain conditions that are common, that are easy to screen for, and that the screening is quite reliable. So for instance, for many years we've had pap smear screening for cervical cancer in women, and more recently we've had bowel cancer screening in Australia as well. Now they're both common cancers, much commoner than bladder cancer, and we have screening tools that are effective enough and reliable enough that it justifies the cost of rolling them out. Prostate cancer, again, there's been a huge debate as to whether we should or shouldn't screen. Personally, I feel that we probably do. It meets the criteria. Another common cancer. Should you be screening routinely for bladder cancer? From a public health point of view, it doesn't meet the criteria. It's not common enough. It doesn't have an easy to apply screening test. So it's probably not ever going to be recommended for a national screening program. But as I said, if I'm seeing a patient regularly, particularly an older patient, part of my annual examination is probably going to be doing a dipstick urine test. Now that's not screening for bladder cancer. That's looking for a whole range of things. Have they got too much protein in their urine? Have they got a whole range of other things, signs of infection? But if I see blood, then that might lead me off into investigating for bladder cancer. So at this stage, I don't think there's any likelihood that there's going to be a national screening program for bladder cancer. But as part of your annual health checkup with a GP, certainly take a urine specimen along, get them to test it. And again, they'll be asking you about other symptoms, ones that we discussed earlier, that may indicate that they may want to look for things like that. Remember, screening programs are for people who are completely asymptomatic. In other words, they have no sign of a particular disease. The moment somebody comes in with symptoms or signs, it's not a screening program, it's an appropriate sort of investigation of those symptoms or signs.